Welcome to the Rand Health Talk Show, your weekly guide to clear, simple, and expert health information. Stay informed, stay healthy, stay with Rand. Rand Medical Imaging. We care, we listen, and we help you make the right diagnosis.
Hello. Guess what we will be doing today on the Rand Health Talk Show? My name is Loretta Taylor, and I'm here with our guest, Mr. Frederick Esuman. Mr. Frederick, kindly give us a brief introduction about yourself.
Okay. Hello, listeners and viewers. My name is Mr. Frederick Esuman, and I'm a laboratory scientist here at Rand Medical Imaging and Health System. I've been in the laboratory field for 6 years now, so I have 6 years of experience in the laboratory settings. Okay, thank you.
Wow, that's amazing. Mr. Frederick, we've been hearing the word sample, laboratory sample. What is it? Can you tell us the meaning of the word laboratory sample?
Okay, thank you. Okay, so a laboratory sample is a small quantity of a material, let's say a blood sample, a blood or cell or tissue. It could be urine or a stool that is taken from a patient and then is used for analysis in the laboratory for research purpose.
Interesting. Okay, so what happens when a sample is being collected in the laboratory?
Oh, okay. So when a sample is being collected, we have something we call pre-analytics. There are some criteria that a sample will have to meet before we accept a sample. So if it meets the criteria, we accept. If it does not meet those criteria, we reject the sample. And then these criteria are the sample should have a labeling. It should be labeled with the patient's name, the age, the sex, and then the date the sample was taken. So if the sample has all these, we also go ahead and check if there is clot or hemolysis in the sample. If there are some cases where samples shouldn't contain any clot, so we check for clots in those samples, or we check for hemolysis in the sample. If they pass, yeah, we can accept it. But if at a point each of them does not meet one of the criteria, we reject it, then we request a new sample to be.
Oh, okay. Yeah. So what are the steps taken to ensure that sample collected belongs to the correct patient?
Okay, so that is what I was saying, the pre-analytics. So let me take you to the process. When a request form comes, you get the request form, you go and then you call the patient. You make sure you call the full name of the patient. And then if the patient responds, you make sure you confirm the age of the patient, and then the sex. Make sure everything on the request form tallies with the details that the patient give you before you go ahead and then take the sample. And then before you take the sample too, you have to explain to the patient what you are about to do. Yeah. The patient will have to give you the consent before you go ahead and then take the sample.
Wow. Yeah. What happens if a sample collected is clotted or mishandled? And then how do you manage such issues?
Okay, thank you. So for samples collected, we make sure that they are devoid of hemolysis, or if it's a sample that shouldn't contain clots, we make sure we check for all of that. So if it's usually we do receive samples from other facilities. So when we receive those samples, we make sure we check all those criteria and then we make sure they pass. If they do not pass, we will just kindly call the referring facility and then tell them how to take the sample and then resubmit a new sample for us, which will be suitable for the analysis so that we can get a good result to help our patients and then also our prescribers.
Oh, okay. So from your working experience, what are some of the sample processing stage and then the crucial one to be precise.
Okay, okay. Thank you for the question.
Okay.
So in the laboratory setting, every stage of the laboratory work is crucial. So from phlebotomy to dispatching of reports, every stage is crucial. So whoever that is working, whoever that is at post at each department of the work or each session of the work should be very, very vigilant, because in phlebotomy, that is sample taking. You can get needle prick. So you have to make sure that you follow all the safety protocols so that you can prevent or you can stop exposing yourself to needle prick, because there are a lot of samples or patients that do come in. Yeah, so you have to make sure that you protect yourself and then you also protect the patient by making sure each sample that you take, you label them accurately, yeah, before you make the patient leave.
Oh, okay. So can you tell us what happens in the analyzer once you load the sample?
Okay, so in the analyzer, there are various analyzers that we use. We have the
Okay.
full blood count, fully automated analyzer, we have the chemistry. There are a lot of analyzers that we use. So each analyzer and its principle of operation. And so if you take the full blood count like this, it analyzes the blood sample for the white blood cells, the red blood cells, the platelet count, the hemoglobin, a lot of parameters. So the machine is programmed such that all these parameters will be calculated accordingly. And then as a laboratory scientist too, you should be able to deduce that, okay, this report that this machine has given is the right result
Oh,
per the
okay.
query of the patient or per the look of, with experience, per the look of the sample, you should be able to tell the range of, let's say, the hemoglobin. You cannot
Okay.
just run a sample and then you get a very low hemoglobin level and then you just print out reports. That is why we, in our standard operating procedure, there are times that you have to repeat it. You
Okay.
see, so if you don't understand the result that comes out, you have to repeat it. And then that is why we also do the quality control of the machine. You have to
Okay.
run maintenance. You have to be maintaining the machine. We have daily maintenance, weekly maintenance, and then we have monthly maintenance as well. Thank
Okay.
you.
So how does RAND ensures that laboratory results are accurate and reliable?
Okay, thank you. So at RAND, our safety protocol and then quality assurance of our instrument is very, very at heart over here. So we make sure that all our instruments are calibrated and then all our controls are of standard quality. And then we also make sure that the samples we run, we take count of them. So let's say in every 50 samples, we make sure that we run another control of the machine, or we
Okay.
try to maintain, we have a count for it. We don't just run samples and then when we feel like we want to calibrate the machine, we calibrate it. There are a number of samples that we run, and then exactly when it is up to that number, we make sure that the machine is recalibrated. All the safety protocols are being taken care of. The maintenance, the daily maintenance of the machine, probe cleansing and all that is done. Yes, because it is of that's when we can get a very good result and then keep our name. Yeah, so our hallmark here in RAND, we make sure that we adhere to the standard protocols that governs the laboratory. We make sure that all the time our SOPs, we follow them, and then also we make sure we recalibrate our machine, inviting of engineer every quarter of the year. So
Okay.
at April, at around July, at around November, thereabout, we make sure that they come 4 times a year. An engineer
Okay.
come to service all our machines.
Okay.
Yeah, so with that, it helps us to able to take care of our machine so well. And then when it comes to our reagent too, yeah, we make sure that the reagents we are using are all up to date. Yeah, they are from good manufacturers. And then we make sure that every reagent that comes to has a temperature at which you have to keep that reagent to be able to
Okay.
work well. So if you don't take care of the reagents and then you say your machine is calibrated well, maybe your reagents that you are using are not in good condition because of the fluctuation of temperature that you give to the reagent. So we
Okay.
make sure that all the time our reagents are in good condition. We have thermometers attached to each fridge that will check the temperatures of the thermometer if it is within the range of which the reagent should be. If it is not, that means our refrigerator is not working well. You have to change it. So all those small things are of vital to us so that we eliminate mistakes in our work. Thank
Oh,
you.
okay. So what are some of the safety measures you follow to ensure that patient results and the laboratory personnel are protected?
Okay, thank you for your question. So the safety measures that we do is we undertake is we make sure patient confidentiality works.
Okay.
Yes, we organize training for our staff on how to handle patient results and then how to speak to patients, even in the sample room or after reports are out. Yeah, because most of our cases are referral cases. So we make sure we communicate with the doctors that refer those patients to us
Oh, okay.
in time. So if there is a patient that has come to run a particular test, we make sure by the time the patient gets back to the facility he or she came from, the doctor has a knowledge about what transpired over here. And then the best decision that the doctor will take to help the patient will be available before the patient gets there.
Can you share an example with us how you double check or verify patient results before it's being released?
Okay, so that's a very good question. So in the laboratory, all the time we make sure there are 3 staffs on duty. So if one staff does a test and then the results staff A thinks the result is positive, yeah, we don't just report it and then give it out. You make sure that the other 2 staffs also check the report and then confirm it so that yes, we have a concrete result that yes, this is positive or this is not. If you have to repeat it, we repeat it. Unlike other facilities that are so concerned about their test kit or their reagent, of
Okay.
which they wouldn't want to repeat a test. Over here at Rand, if you have to repeat it 5 times, we'll do it so that we make sure that we are doing the right thing for the patient. Yeah, that is one thing that we do over here.
What do you wish every patient would understand about laboratory processes?
Okay, what I wish other the patients will understand about our process is that our process sometimes takes time because we want the best for them. It takes time, so they should bear with us. Sometimes your test will tell you your test will take an hour, but the actual test will take 45 minutes to run. But at the end of the 45 minutes, we may find out that, oh, this report that we are getting, no, we would want to repeat the report. We
Yeah.
want to repeat the test again. So that means it has to go another 45 minutes.
Oh,
You understand?
okay.
So that is when sometimes a patient test result will delay. It's not that we are just trying to delay it. We are just trying to make sure we give out the best result that will be of help to them. We can't just give out any result that will worsen their situation. We only want to give out results that will help them get a remedy to whatever they are going through.
Okay. So how does some medications, dehydration, and then other factors affect a patient's laboratory results?
Oh, okay. Thank you. So there are tests that requires a patient to fast for. There are tests that sometimes requires you to fast for at least 12 hours. So if there are other patients too that they take medication, if you come to a test, let's say a test like lipid profile, there are some of the patients that undergo or take that test are on treatment. So let's say there's a patient coming for a lipid profile test and the patient has to fast for 12 hours. So the patient is in, and then because you ask the patient not to eat, the patient has taken medication. Yeah, the medication will affect the test result because the work of the medication is that it will help break down the lipids. So it will suppress the lipid in the body at the particular time that we are taking the test. So it will give us a false negative result. That means it will tell us that the cholesterol is low. Meanwhile, it is high, but it is because of the medication that you took that has made it low. So we want patients to adhere to whatever we tell them before they take a test. So if we ask you to fast before you take a test, make sure you don't take anything. If you've taken anything too, you have to declare it, or you have to tell the phlebotomist about it before your sample is taken, because it helps us so much so that we know that yes, we are doing the right thing or there's an interference with the test we are doing.
What are some of the mistakes patients make before coming for a laboratory test?
Okay, so that is what I was talking about, that there are some tests that you don't have to eat, but a patient would come in and then might have eaten. Sometimes it's communication, sometimes they don't. Some patients will call and then ask about the test they are coming to do and then instructions related to the test, but others too wouldn't get time to do that. So right when they come in, they want to take the test, but because you have to fast before you do the test, we end up referring them to come on another day, and then it doesn't help the procedure. So
What is the memorable day in the laboratory where you found that your work is so important?
oh, okay. So there have been a lot of instances because over here most of the cases are referral cases. So there are certain cases that will come in, and then the issue of the patient that he or she came in with, maybe there's they've diagnosed the patient of a particular disease, and then upon coming here, our work or our effort to conclude that maybe the patient doesn't have such disease. Yeah, it makes us feel happy. And then when we are able to help the kids, over here we get a lot of babies over here. And then you just get to know that yeah, if you go to any other facility, they don't want to take the sample because it's a baby. But over here, we have time for babies. We take care of them, even if it's an hour that we spend on the baby, we'll do that. And then I think, yeah, we are happy to help the kids in.
Oh, meaning
Yeah.
taking baby sample is very difficult.
Oh yes, it's very difficult.
Wow.
Sometimes. Yeah.
So what are some of the common misconceptions people have about laboratory tests?
Oh, okay. So the basic misconception people do have about laboratory tests is getting result of a different person. maybe mistaking or changing of samples. That is what we do here more often, changing of
Okay.
samples. So over here at Rand, we try to speak to patient that if you go to any facility and then you want to take a test, make sure that after taking the blood sample, make sure your name is written on the sample, your age, and then your sex. You make sure you see that with your eyes before you leave the
Okay.
phlebotomy room. Yeah, because that is the basis of all that. When you don't see it, that is when those things go on, because they can take two or three different samples belonging to different people, and then it is not labeled. But over here at Rand, before we take your sample, we try to educate you on that, and then also let you clarify the spelling of your name before we let you leave the sample
Okay.
room.
So what should a patient do if a laboratory test result given to him or her is not well understood?
Okay, so over here at Rand, we do give basic explanation of results.
Oh, okay.
So if we do a test for you and then you need an explanation, we give a basic explanation of reports for you. But the detailed explanation is in the hands of your doctor. So after giving you the basic explanation, we refer you to take the report back to the doctor that is taking care of you to go on with the further explanation and then the other diagnostic processes that you undertake.
Okay, so if you could give a patient one advice about test received and then what he or she came in to do, what would be that best advice?
Come again with the question.
If you are to give a patient one piece of advice to ensure the best lab results, what would be the advice?
Okay, so to get the best lab results, I think you should follow all the protocol that is given to you before the test. You would have to find out how to prepare for the test. Yes, if you know how to prepare for the test, I think that will help you get a good report. If it is a 12 hours fast, you make sure it's a 12 hours fast, and then you come on time, and then yes, I think if you follow the protocols given to you about the test, you shouldn't have problems of a test result over here at Rand, because our side of the work, we'll make sure we do it, and then we also want you to do your side of the work. If you do your side and then we do our side, I'm not sure there will be any problem that a patient will face.
Okay.
Yeah.
So how do you think educating the public about lab processes can improve their health profession?
Okay, I think educating patients about, because there are misconceptions. People are scared to come to the hospital or the laboratory setting because most of them are afraid of needle pricks and then all that. So it's just a short procedure, and then it helps you to know your stand. It helps you so much, because if you come to the laboratory and then you run a test and then it comes out, and then even if you find out something and then it is early, it helps. If you come and then we find out something, we'll just go ahead and then educate you on the next thing to do, to see a doctor, to do this, to do that. It helps. So I would advise patients to day in, day out, work in and then have their cells being checked on, run tests. There we have packages over here that you can come and sign up for. You have the Run Life Care package that you can sign up for. We run diff variety of laboratory tests and then also scan for you, so that you make sure your health condition is of the best. Yeah. And then we work with a lot of hospitals. So if you are here and then We will run a test for you, or you come for a procedure. After the result, we can give you the best doctor or the best facility to visit, so that a further process can be taken.
Interesting.
Yeah,
That sounds great. Thank you for joining us today.
you're welcome.
Viewers, I hope you really enjoyed this insightful and educative moment. Thank you for watching us and see you next time.